systems run. The health of those inside our facilities and our communities on the outside are best served by greatly reducing the numbers of people incarcerated while also maintaining public safety. We have seen the heightened risks this virus possesses in custody facilities across the country, and we must do our best to avoid that same fate. I appreciate that the sheriff has released people who are within 2 months of their scheduled release date. I hope that he'll consider releasing people who are within 4 to 6 months of their release date and continue to find ways to release as many people as possible who are considered nonviolent. We can't wait until an outbreak occurs to take these actions. And I'm also just as concerned about the young people that are in our care. I'm pleased to share that as of today, we are close to having no pregnant girls incarcerated at a critical time that we have been going through this crisis. We know how very important that is. These girls should not have been incarcerated before COVID-19, and they shouldn't be incarcerated now. We must release these young people who are close to their release dates and can be returned home or provided non-custody placements where they can receive the needed support that they deserve. This week, I have asked our county agencies to ensure our staff and people detained in facilities to have access to masks and other protective equipment, as well as adequate access to soap and other products to ensure improved hygiene. Last but not least, I want to thank our community-based providers for their continued work to ensure that those returning home have a chance to succeed in their communities and neighborhoods while maintaining the health and safety of everyone involved. I urge our community partners to please let the county know how we can continue to support those efforts. In conclusion, I want to thank all of you very much, and let's keep working together. And with that, it's my pleasure to introduce our Public Health Director, Dr. Barbara Ferrer.
Good afternoon, everyone, and thank you so much, Supervisor Solis. I'm grateful for your strong and compassionate leadership, and particularly for your focus on making sure during these really difficult times that we remind ourselves that it's important to use a justice framework when we're looking at the impacts of this devastating pandemic. And I also want to thank all of our leadership across the county, particularly noting Dr. Galley and the sheriff. Our work doesn't happen unless we're able to collaborate and work in partnership, and it's just been an honor to be able to work with such an outstanding group of colleagues here at the county and across the city. I do want to update you on our current status, but I also want to use some time today to talk about an extension, as Supervisor Solis noted, of the health officer order. I want to touch a little bit upon a new requirement for us to be using face coverings when we're engaged with other people in public and private spaces. And I want to close just with a brief explanation of the seroprevalence study that began today. So I have a lot, so I'm going to try to move fairly quickly. And then, of course, we'll be available to answer questions. I'm really sad to start my report reporting an additional 18 deaths. 10 of the people who passed away were over the age of 65. 7 people are between the ages of 41 and 65, and 1 person was younger, between the ages of 18 and 40. This brings the total number of deaths across the county to 241. And our mortality rate associated with COVID-19 is 2.9%. The most difficult part of the COVID-19 pandemic is losing people to this virus. And to all of you who have lost loved ones, we're deeply sorry. And as you heal from your loss, please know you remain in our thoughts and prayers every day. Today we're also reporting 475 new cases. Over the last 48 hours, there have been 900 new cases, and that brings our total to 8,430 cases across LA County. These cases include 303 cases that are reported by our partners in the city of Long Beach and 107 cases reported by the City of Pasadena, both which have independent city health departments. I'm also going to confirm that we have 18 cases among people experiencing homelessness. 2 of the 20 cases I reported yesterday were actually not positive upon further investigation. The majority of people who are experiencing homelessness who have been positive for COVID-18 have been people who are unsheltered. There are 3 people among the 18 who were sheltered. They're now appropriately isolated, and close contacts have been quarantined. We have about 2,043 people who at some point in time while they were positive for COVID-19 were hospitalized, and that's 24% of all of our positive cases. Around 20% of the folks who did require hospitalization at some point also required a ventilator. And you can see an updated report of LA County cases on the Department of Health's website at publichealth.lacounty.gov. We currently are investigating 159 institutional settings with at least 1 confirmed case of COVID-19. This is 4 additional investigations since yesterday. And as a reminder, these include investigations that are happening at nursing homes, assisted living facilities, shelters, treatment centers, supportive living sites, and correctional facilities. The total confirmed cases in institutional settings has jumped to 1,062. This includes both staff and residents. 506 of the confirmed cases are among residents, and 556 are among staff. And I'm sad to report that 67 people who have passed away from COVID-19 were residents in institutional settings. And this includes both skilled nursing and assisted living facilities. And this now represents 28% of all of our deaths. So more than 1 in 4 people who have died were people who were residing in an institutional setting. We're reporting 53 confirmed cases across our jails. This includes 8 inmates and 45 staff. There are 23 cases that have been reported in the state prisons. This is among 12 inmates and 10 staff. And we remain at only 2 cases in our juvenile facilities. Both were among staff. We do post a list of all the facilities with confirmed cases on our website once those facilities have been able to notify all their staff, residents, and families. And as a reminder, our DPH staff currently work with every single facility that has a positive case, and we know that management and staff are doing their very best to protect the health of their residents. We also acknowledge that residents in many of these care settings are in fact very vulnerable to high risk for serious illness from COVID-19. Most of the residents have underlying health conditions, and many are in fact older. Residents in these facilities who have been in close contact with a confirmed case or a potentially confirmed case are in fact quarantined once they've been exposed. The LA County Sheriff Department reported 29 positive cases among their staff. 376 of their staff remain quarantined, and 223 staff are back to work, and I'm sure the sheriff can provide more details on that. The LA County Fire Department is reporting 14 positive cases among their staff. They have 27 folks who are quarantined at home. They have 2 people who are isolated at home because they're ill, and 12 of their staff have already returned to work. And I want to once again thank Sheriff Villanueva and Chief Osby for tracking and reporting this data to us every day. As of April 9th, over 40,600 people have been tested for COVID-19 and had those results already reported to the county. 15% of people who have tested to date have been positive. And although the testing capacity continues to increase, we are still working with some of the newer labs to get a copy of electronic lab reporting from them. And we still continue to recommend testing only for those people who are symptomatic. I now want to turn to updating updating all of you on our efforts to stay safer at home and our health officer order. We are announcing an extension of our current order through May 15th, 2020. And the extension of the order also includes a couple of new measures that I will describe. I want to note that we're extending the health officer orders, which, as you know, require a fair amount of distancing and continue to keep in place closures of non-essential businesses, not because everything everyone has been doing isn't working, but as you'll hear from Dr. Galley in a few minutes, it's because it is working. We know it's effective, but we still have a ways to go in order to both protect the lives of people who live in our county and to make sure that our healthcare system remains fully able to service all who need their care. So I appreciate that for many of us, this announcement that we will extend the health officer order is causing a significant amount of distress. I know that many of you were hoping we would get to the end of April and we'd be able to lift many of these restrictions. And I'm as sad as you are to note that this is not the time to lift. But I also am really hopeful, as I think you will be when you see the modeling efforts, that because everyone here is doing their part, because people are heeding the directives, we have in fact seen what we now can confirm is in fact the flattening of the curve in a way that's actually saving lives and allowing us to have a chance at making sure that our healthcare system remains able to serve all who need care. But because there are so many people that are infected in LA County, and because there is still so much spread, we have to continue to keep ourselves physically apart from each other during the next few weeks. So as a reminder, all indoor and outdoor public and private gatherings and events continue to be prohibited. Beaches, trails, trailheads, and playgrounds remain closed, and all non-essential businesses will continue to be closed to the public through May 15th. There are a couple of new measures that ensure that people who are working in essential services are safer while they provide us with the very essential services they offer. And the offer now requires that essential businesses provide all of their employees whose work requires them to be around other employees and or the public. They're required to issue them a cloth face covering that they wear while they're performing these duties. Essential businesses are also required to provide a plan, to share the plan with all their employees and post the plan in a visible place at their business that actually explains how they're implementing the physical distancing and cleaning requirements in their workplace. And I want to thank our businesses for really helping us make sure that employees are safe and that when you enter into an essential business, everything possible is being done to keep all of us safe as we either try to purchase a service or have a service provided to us. Most importantly, I'm really glad that we're all joining together to protect those frontline workers that provide us with these very essential services. We'll be conducting briefings, telebriefings with essential businesses all through the next week, and our environmental health inspectors will be out to help businesses understand and come into compliance with the order. The order for providing employees with cloth face coverings and posting information about the physical distancing measures that are implemented at each site go into effect next Wednesday at midnight. So folks have some time between now and next Wednesday to actually come into compliance with that part of the order. We can still engage in our outdoor activities as an individual or with members of our household. We can leave our homes to access essential services or provide essential services. as long as we're practicing physical distancing, and when we're with others, we're wearing a cloth face covering. This protects you, other people accessing services, and the people who do these essential jobs. So from here on in, when you go into a business or a site that provides essential services, you too need to put on your cloth face covering so that you provide some protection to all of those who are inside a place of business or providing you with a service. Extending safer at home really means that we're able to keep in place the measures that we know at this point in time are working and preventing a huge acceleration of cases of COVID-19. And I want to thank everyone who's already following these orders, and I want to acknowledge that we're asking a lot of all of you to continue practicing safe distancing and protecting each other. Please keep doing what you've been doing. Stay home. Use that cloth face covering when you're out and about and in contact with other people. And I know we're going to get through this together. I do want to talk a little bit about the safe use of a cloth face covering. And this is something for you to use when you're interacting with others who are not members of your household. And you can use it in both public, you ought to be using it in both public and private spaces. It's important that the face covering be made out of cloth so that it's easy to breathe through. And cotton is a good fabric to use. And I want to show you a few things about what we're recommending. So before you put on your cloth covering for your face, you need to either wash your hands, and I can't wash them now, or sanitize them. Then when you put on your face covering, you need to make sure that it's going to cover your nose fully and your mouth. When you get ready to take it off, you should, again, since you've been out and about, make sure that your hands are clean. If you have access to a place to wash your hands, that's great. If you don't, it's hand sanitize again. Take your face covering off. Try to make sure you fold it carefully with without touching what was touching your face. And then it's best if you have a paper bag and you can actually put it in a paper bag. A paper bag breathes, but it also protects your face covering from collecting germs if you happen to throw it on your car seat or dump it into your backpack or put it on a table that's not necessarily clean. So this would be the best you can do. And then when you're done and you've put it in your bag, before you go touch anything else, because you've now touched your face covering, you should sanitize again or wash your hands again. This is a lot, but if we do this and then we launder or wash our face coverings every day, they will provide the protection we want to provide to others who are near to us, and they'll also keep us from using face masks that may make us sick because we're not taking good care when we're using them. So a couple of reminders. Please discard a cloth face covering that no longer covers your nose or your mouth, that's stretched out or has damaged ties and straps, that doesn't stay on your face, and that has holes or tears in the fabric. Anyone who cannot remove a cloth face covering themselves, who is having trouble breathing or is unconscious, should never wear a cloth face covering. Children 2 and under should not wear cloth face coverings. And for children between the ages of 3 and 8, please make sure that there's an adult that's monitoring their safe use of a face covering. While cloth face coverings are useful in preventing the spread of COVID-19, they do not replace the powerful tools of staying home, physical distancing if you must be out of the home, and that means keeping 6 feet apart from others, and washing our hands frequently. I want to close by talking just for a minute about the Seroprevalence Project. This is a community surveillance study that we're doing in partnership with the University of Southern California to better understand the spread of the virus in the LA County population. A random sample of 1,000 adults that reside in LA County will be tested for COVID-19 using an antibody test. That's a different test than the molecular lab tests we use to detect whether or not you're infected at any one particular moment in time. And it's also referred to as a serologic test. This serologic test doesn't actually detect virus. What it does instead is it measures antibodies to the virus. This is what your system will respond to if the virus is has in fact infected you. You will develop antibodies and will be able to detect both current and past infections in any of the people that are participating in the study. This gives us powerful information about how many people have already been infected with COVID-19 in LA County, regardless of whether they ever became sick or ever were able to have a molecular test to determine whether or not they had the presence of the virus. We're also going to be able to gather information about gender, age, race, and ethnicity. And among those who are infected or were infected at some point in time, we will note how many people had symptoms and how many required hospitalization. This information will help us better understand how COVID-19 is showing up in our communities, and we plan on continuing to sample residents over the next few months so that we'll continue to gather more and more information about how this virus has showed up in all of our communities. I do want to note that the study does not tell us if people who were infected are now immune to COVID-19 virus. We are assuming that they are based on other studies of other viruses and other coronaviruses, but that will be a separate study to actually verify the immunity status if in fact you have antibodies that have developed to the virus. As part of our work moving forward, we're planning ahead, as I know you all are as well. And to do that, we're creating a scientific advisory panel for COVID-19. Because COVID-19 is a new virus and the science is rapidly evolving, we learn more and more every day. And the scientific advisory panel will be able to convene and to share and understand the science that's coming out around what we know about COVID-19. They'll help us at Public Health answer some critical questions, such as what communities and individuals experience most harm, and what are the natures of those harms, and how can we mitigate the unneeded harm? How can we improve our tracking of where we are in the course of the pandemic? And what is the extent and importance of asymptomatic infection? And what is the strength of immunity to the virus? The panel will include representatives from academia, clinicians, and community researchers. As I've mentioned, we're already planning for LA County's COVID-19 recovery phase, and it's really important that we be informed by science, and we need the ability to be able to share information and new learnings. So in closing, every day we do get closer to being on the other side of this, and I thank you all for continuing to follow the Safer at Home orders. What we're doing is working to save lives and slow the spread. And now it's my pleasure to introduce Dr. Galley, the Director of the Department of Health Services.
Hi, I'm Dr. Christina Galley, the Director of the Department of Health Services. Thanks for joining us again today. Today, I'm going to walk through a little bit about the work that the Department of Health Services has done in partnership with public health and other entities to help project out the demand for hospital services in Los Angeles County in response to the COVID-19 pandemic. I think a few of the key points that we want to make sure are highlighted today is the importance of these public health interventions, including physical distancing and infection control measures like hand washing that Dr. Ferrer just mentioned, and how critical that is in flattening the curve, which is something I'll talk more about in a minute. We know that physical distancing is working. It has saved lives, and continuing it with the extension of the health officer order will help to save more lives. We also want to help make it clear to the broader community that the hospital system, public and private, across the county is here for you, has prepared for the surge in patients that might come, and according to current projections, is able to manage the volume of patients with COVID-19 that we anticipate will come in the coming weeks, in addition to being able to maintain care in hospitalized settings for individuals who need hospitalization for other reasons, whether that's an injury or an illness or a chronic health condition that requires hospitalization. I know that everyone has been impacted in some way by the COVID-19 pandemic. And for those who mourn the loss of life of a loved one or a friend, I extend my deepest sympathies. For many others, this physical distancing and the measures that have been put into effect have had an economic toll. They've been laid off, their unemployment rates we know are higher, and the economic impact of this is also felt far and wide. And even for others, and certainly I think all of us in our own way, we're all adjusting to this new normal that we find ourselves in terms of physical distancing. We're adjusting to being at home. We might be working to adapt to a telework environment, or we're an essential worker as a first responder or a healthcare worker or a government employee in other settings, or we work at a grocery store, or we have another job that is so essential for keeping society going. And you've had to adapt as well. Many of us have children at home, and we're adapting to the distance learning environment that is part of that. And in the midst of all of it, we're also trying to take care of sick or elderly neighbors or loved ones. The adjustments are there for all of us. It's the responsibility of the Department of Health Services in the midst of this pandemic to both maintain the operations and ensure the capacity to care for individuals in our 4 public hospitals: Los Angeles County USC Medical Center, Harbor UCLA Medical Center, All of You UCLA Medical Center, and Rancho Los Amigos. We also have a role in our oversight of the EMS agency of working with all hospitals across the county, public and private, to make sure that the hospital system broadly is prepared and has the supplies and resources that are needed to help take care of the patients that will come. We are doing everything we can then to be able to model out the expected course of this pandemic and make sure that the preparations are sufficient for the volume of patients. Because of that, we've assembled a very talented team over the past several weeks to make the best possible predictions using the available data to be able to project what the spread of COVID-19 will be in the Los Angeles County community and the associated demand on hospital resources. We've posted to the county's COVID-19 website a set of charts and graphs that help display more visually what I'll walk you through now. So please do go to the website and take a look at those slides, as I think they're very helpful to be able to see. I do want to acknowledge several of the individuals that were involved in this effort, as it's been a full-time job, as I'm sure you can imagine, over these past several weeks. First, I have to acknowledge the team lead, Dr. Roger Lewis. Dr. Lewis wears many hats, but among them, he is the director of the bed demand modeling project within Los Angeles County. He's led a very talented team of individuals to put together the projections that I'll walk you through. He is also the chair of the Department of Emergency Medicine at Harbor UCLA Medical Center, one of the public hospitals within the Department of Health Services. And in that, he has taken care of COVID-19 patients and understands very clearly what is needed to surge in a hospital capacity and in a hospital environment to take care of patients. Also on the team are a number of statisticians and epidemiologists who have supported this work. I want to offer my thanks to all of those individuals, and I'll call out a few by name, to the Berry consultants who are based in Austin, Texas, specifically Joseph Marion, Kurt Ville, and Todd Graves, and to the local LA County modeling team, which includes Juliana Tolles, also a physician at Harbor UCLA Medical Center, Dr. Claire Jerishow, who works for the Department of Public Health in their Epidemiology and Acute Communicable Disease Division, to Fei Wu from the Chief Executive Office, and to Frederick Schoenberg, who's a professor of statistics at UCLA. Together, this team have worked in partnership with others, including the California Department of Public Health and academics at other institutions, including Hopkins and other sites, to help put together the model, adapting it from other models that are out there, and being able to generate a set of projections that is specific to Los Angeles County. To set the stage a little bit on the context, when you hear about flattening the curve in epidemiology circles, and what you've heard me talk a lot about and Dr. Ferrer talk a lot about, it really means three things all at once. The first thing is it means being able to delay in time the date on which there's a peak number of cases. So instead of having the peak today through physical distancing measures and through other public health interventions, these interventions are able to push out that peak in time. This is very important for a number of reasons. From the hospital perspective, it's critical in allowing time for hospitals to be able to prepare for a surge in patients. It allows them to build up additional bed capacity, to secure additional personal protective equipment, supplies, equipment like ventilators, to onboard additional staff that are needed to supply the beds, to put in place the medications and the services that are needed to support the patients with COVID-19. It also buys time and extent by pushing things out in the future for the development by the scientific and the clinical research community to develop treatments that would be specific to COVID-19. And we're grateful for all of the work of so many people in the pharmaceutical and the research sectors for their work that is ongoing in this realm. And also simultaneously, there's work to help generate a vaccine and develop a vaccine. While a vaccine is not anticipated in the near future, current estimates are still that it's about 18 months away. Any amount of time that we can push that peak amount of cases into the future is time that we get closer to that vaccine. The second thing flattening the curve means is that it reduces what that peak will be. So instead of having a peak that might overwhelm the healthcare system with the large volume of patients coming all at one time, such as we've seen in some other locations and countries, the public health interventions can lower that peak and make it so the peak is a level at which the hospital system can take care of the patients that come. And it has sufficient capacity for both the COVID negative and the COVID positive patients. And the third thing is it reduces what we call the area under the curve, and you'll see that on the charts, but it reduces the total number of patients that might be infected with the virus over time. What we know and what we've communicated to you hopefully in the past and what I'll try to make clear again today is that physical distancing is working. Together with the infection control interventions like hand washing and wearing masks, which hopefully everyone is learning how to do, these are the biggest weapons that we have in our arsenal to fight COVID-19, and the efforts are working. They have flattened the curve, they have reduced that peak, they have pushed that peak out into the future, and they have made it so that the hospital system is projected to be able to manage the number of patients that would become ill with COVID-19. By doing this, very simply, you have saved lives. Your efforts to stay at home, to quarantine and isolate, to follow all of the health officer orders has helped save perhaps your own life, perhaps the life of a family member, perhaps the life of a friend or a loved one or someone in your community or someone in your workplace or your school. And for that, I'm very grateful. I do know that it's difficult. I know that it comes with a personal and an economic cost, but it is beneficial in terms of saving lives and helping make sure that the hospital system can take care of those who need it. As you'll see on the slides, when you're able to look at them on the internet through the website, you'll see the impact that COVID-19 would have had on society if we had not done the physical distancing efforts outlined by the Department of Public Health. And what you'll see is that sharp curve upward that would have resulted in a high peak, and then the situation today, which is a much flatter graph to the point that we're able to take care of those patients. If we were to stop physical distancing at this point in time, while we would still succeed in pushing out those cases out further in time, we would go back to that same original peak on that same slope, which would result in a large increase of cases of COVID-19 that would run the risk of overwhelming the healthcare system and making it so that people are not able to receive the care they need. If physical distancing doesn't continue, similarly, we would project that by April 1st, by middle of the summer, virtually all residents in Los Angeles County would have been exposed or infected with COVID-19. The projections show that up to 96% of people, so again, virtually everybody, would have been exposed. And we know that for every 100 people exposed, 3% of those people need hospitalization, and 1% of those people need intensive level care or ICU care. And the vast majority of those people in ICU care require mechanical ventilation. So we're talking about a large number of individuals that would have required hospital care, with that 96% of the population being infected. However, by continuing the physical distancing measures that we've taken and that you've taken, we project that we'll be able to reduce the overall infection rate among the community down to 30%. It's a huge decline in the number of people that are infected. And if we can be slightly more successful in physical distancing, more successful in the quarantine and isolation orders, have an even sharper decline in the amount of time people spend outside of their home, then we're able to reduce that curve even further so that the total number of people infected would be less than 10% by August 1st. Given that we know that physical distancing is effective in slowing that transition, we also did the modeling specifically on the bed numbers, and I've alluded to this previously. But very specifically, I want to make sure people are aware and confident that the healthcare system is able to manage that projected increase in patients if we maintain the current physical distancing guidelines that are consistent with what Dr. Ferrer just described with the extension of the health officer order. So for total hospital beds projected over the next month, we project that we are able, within the existing hospital supply, without any additional surge, to accommodate all of the patients that need care for COVID-19. For ICU level care, we anticipate that there is a potential need to add some ICU level beds on the order of about 400 to 500 ICU beds over the next month. Those efforts are already underway. The Mercy ship has the ability to add an additional, or has an additional 80 beds. The Los Angeles Surge Hospital, located on the campus of St. Vincent's Medical Center, the former St. Vincent's Medical Center, and which is the product of a public-private partnership between the state, the county, Dignity Health, and Kaiser Permanente, it has the ability to add ICU beds. The Department of Health Services, its 4 hospitals, also has the ability to surge up an additional 100 to 150 ICU beds, and private hospitals also have the ability to add ICU beds. So the slight shortage of ICU beds that is projected in the model is well able to be corrected for in the days and weeks to come, and there are already multiple efforts underway to do so. With respect to ventilator capacity, which is, I know, something that's in the news a lot, and we receive a lot of questions related to ventilators, we project that the county has no shortage of ventilators. There are currently about 1,400 or so available ventilators, taking into account what is available in public and private hospitals, as well as taking into account the extra stock available in the EMS agency. And that is more than sufficient to be able to take care of the mechanical ventilation needs of patients who have respiratory failure. We know that physical distancing has taken a toll on the whole community, but I want to thank you for your efforts to do so. By you physically distancing, by following the health officer orders, by staying at home, we've been able to flatten the curve, reduce the number of people infected, but help support the hospital system and make sure that it can add beds in the few places where we know we need to add beds, and help make sure hospitals are equipped with the supplies and equipment and the staff they need to care for patients. So while it's difficult, I'm grateful for your efforts. I thank you for continuing them for the next several weeks, and I wish you well. With that, I have the honor to introduce Sheriff Alex Villanueva. Thank you.
Good afternoon. On this Good Friday, I want to first take a moment to express my condolences to all of those families in our county and around the world mourning the loss of their loved ones. This pandemic is a fierce opponent, but as my county partners remind you, social distancing is the way to flatten the curve and save lives. I also want to recognize all of our public safety and health personnel working on the front lines who are exposed to this deadly virus day in and day out, and for the sake of public safety, I'm proud and grateful beyond words. I also want to express that same level of gratitude to you, the public, for doing what we have asked you to do by staying home and practicing safe social distancing. I know these are trying times, but we will reemerge from this crisis stronger together. As the COVID-19 pandemic persists, I want to update you on the steps we have taken as a department to ensure your safety. And in patrol, since March 17th, we have redeployed personnel from our detective, court services, and administrative divisions. These deputies are now on patrol at shopping centers, empty business districts, throughout our city streets, and temporary medical housing areas, wherever there is a need for extra patrol. In fact, there are now more deputies on the streets now than ever before. And I want to take the point right now to extend my gratitude and a shout out to a very young, brand new deputy, two weeks from the date that we swore her into office. It was 2 Fridays ago, out of class 446. Yesterday evening, 8 o'clock at night, she's driving home from training, in jail operations training, 8 o'clock at night, in the dark, in the rain, and she sees a lady on the bridge, the Clara Street Bridge, over the LA River, about to jump into the river. And she got out, she dialed 911, and into the rain, went up to her and started talking to her, engaging her, to try to dissuade her from jumping into the river. She was joined shortly thereafter by 6 deputies from East LA Station and a supervisor. And among all of them, they were able to finally get their hands on her and physically force her and push her back over to the safety, and then they transferred her to a local place for psychiatric observation, 72-hour hold. But if it were not for the keen observations and the willingness of this young deputy to step up, her name is Wendy Fuentes. She took an oath and swore and protect the public, and 2 weeks into the job, she did exactly that. So I tip my hat off to her for a job well done. Now, in regards to what's going on in terms of public safety, we do have the continuing trend, downward trend on crime overall, which is grateful and much appreciated. Overall violent crime is down 4.5% compared to the same time period last year. Overall crime, serious crimes, we're called Part 1 crimes, is down 14.36%. Again, much appreciated. And our calls for service has dropped 11% over the same time period. So definitely things are changing for the better for now. So we just have to keep working together in that regards. In terms of enforcement of our health orders, from March 29th to date, we have done a total of 7 citations related to failure to comply with the health orders. And bear in mind, each citation carries a potential fine up to $1,000 as determined by the judge. And then we've made also 1 arrest for a total of 8 enforcement actions. But overwhelmingly, the public is following along, they're complying, and we're here to help the public. We're not here to be the bearer of bad news, but it's definitely a testament to the willingness of everyone to roll up their sleeves and to acknowledge we're out in public now. Now we're up in the status order a bit. If you're out in public, you're going to be doing business anywhere in one of the essential functions, mask up, plain and simple. If you're in your vehicle, no need to. You're at home, no need to. But once you step out onto the street, you're going about doing your business, you're going to be in contact with other people, please use the mask. And as Dr. Ferrer already indicated about our number of personnel under quarantine, it did drop from 447 to 376. That's positive. However, we got 1 more. We have now 29 have tested positive, but we've increased 223 and now back to work, which is all good. Now, in our custody environment, that has been a challenge. However, we took the step starting in February 28th. We dropped our population of the nation's largest jail system by over 20%, which is a huge number. And to date, we have 6 have tested positive. We have 2 that were tested positive early. They have since recovered. They're back to general population. 18 in isolation. And are now all of the measures that we put into place in terms of releasing early those that we could, pretrial detentions, we're working with our criminal justice partners to release those, and we have an agreement between the district attorney, the public defender, and the Superior Court system. So that is all working the way it's intended to. One place that is now we need to draw attention to is the fact that the campaign is safer at home. However, they're not all are safer at home. Many of the traditional methods of detecting and reporting domestic violence, elder abuse, and child abuse are no longer usable because of the COVID-19 pandemic. Victims of these crimes are currently isolated from mandated reporters. Due to the COVID-19, the schools are not physically open, teachers are not physically observing students or parents, no public contact, no doctor visits, no dentist visits, no routine interaction with friends. These are all the normal people that would be able to observe someone who is in an abusive relationship or being a victim of some form of abuse. So it's very important to keep track of your loved ones. If someone is in a wrong relationship or something that they're going to be subject to abuse, please call 911. If it's an emergency, call the business line. We will do that welfare check. We're going to ascertain the welfare of every single person who could be at risk. That includes the elderly, domestic violence, and our children. Okay, but we have to have everyone take that active role to be on the lookout for possible abusive situations, because a lot of our mandated reporters are no longer available. And if you yourself are experiencing domestic violence, you can connect with any of our abundance of services, including a referral to a shelter, by calling 211. Okay, we want to make everyone safer at home. And now, Ryan, we're ready for questions. This will be in English.
Okay, ladies and gentlemen, if you do wish to ask a question, please press 1, then 0 on your phone. Our first question will come from the line of Patrick Healy. Please state your media outlet.
Good afternoon. Thank you. Patrick Healy from NBC4. Very exciting news about the current projection. A couple of questions, though, about emergency rooms and law enforcement use of the face masks. There was a pursuit today involving LAPD. At the end of the pursuit, for whatever reason, a number of the officers did not have on face masks, and perhaps there were operational reasons why not, but what would be the message from public health on what officers should do in that situation? And number two, we're hearing from a number of emergency rooms that their volume of non-COVID cases has dropped markedly, and they think that is due to a fear of patients with heart ailments or diabetes or other issues from coming into the emergency room. Could you address that as well?
Let me address the first part of the question. As a matter of practicality, when you see officers, deputies in their radio car, they're not going to be masked up. Obviously, barrier towards communication, talking amongst each other. It's a secure environment. Once they step out in an emergency situation, we're not going to ask them to be masked up if they're engaged in some physical activity. They may lose the mask anyway. If they're going to go deliberately into a location where they know there's a quarantine situation or person who has the virus themselves, well, they're going to take all of the protective measures possible, which includes masking up, full suit, shield, and everything. So it's on a case-by-case basis. Our Sheriff's Relief Association, for example, just donated 7,000 of these cloth masks for our personnel. They'll be working in custody and patrol on the front line. So you'll see them masked up very often. But for the second part of the question,
Hi, thank you for the question. I think it's an important one. Across the DHS hospitals, as I've mentioned before, our ED volume is down at about 40 to 50% of what it traditionally is. And I've seen several other trends in other private hospitals that are similar. Sometimes this is for good reasons. We know that trauma is down, car accidents are down. We also know that to some extent patients are staying away from the emergency department for things that don't require emergency care. Instead of using the emergency department, they might be calling their physician or doing a telehealth visit or walking into an urgent care or a community clinic. And those are good things. But what we want to make sure people understand is that the emergency department is still there, and it is a safe place to go if you are experiencing a medical emergency. Staff in the emergency department are trained to be able to take care of you. They are taking precaution with appropriate personal protective equipment, and it is safe for you to go there. You don't need to be worried that you might get sick or get infected or get COVID-19 by going to the ER. To some extent, the volume of decline in emergency department services is a little bit beyond what we might anticipate if it was just from the reduction in unnecessary use or car accidents or trauma or things like that. So I think clearly the message to the public is please know that while we don't want you to use the ED if you don't need it, we do want you to use it, and it is there for you, and it is safe to use if you are in need of emergency services. Thank you.
Go to the next question.
Comes from the line of Claudia Pashuta. Please go ahead. Please state your media outlet.
Hi. According to the public health website, there have been dozens of positive cases among children, and I'm wondering if any of those have resulted in hospitalizations or deaths of minors. That's for Barbara. And then Supervisor Solis, or if there's someone else available to talk about this, I believe that the county would be putting out its latest budget proposal mid-April, and I'd like to find out, what projections indicate, the economic toll on the county has been thus far due to the crisis. Thank you.
Okay, let me first go to Dr. Ferrer, and then I will talk about the budget. The little I know.
Thank you, Claudia. You're right to note that we do have cases amongst young people under the age of 18. We've had no reported deaths to date. We are, as you know, waiting for confirmation from CDC on one suspect case on a young person who unfortunately did die. We don't have those results yet. I can look and see what I have on hospitalization data to give you actual numbers. What I do know is, yes, we do definitely have young people who have been hospitalized. And actually, we've had some young people who have been in the ICU. I don't have those numbers with me today, but we can certainly get those numbers to you. Thank you for that. And I'll turn this over to Supervisor Solis.
Thank you, Claudia, for your question. As you know, when we started down this line, Supervisor Barger and I, when we knew that we were going to be faced with this pandemic, actually put a motion forward to freeze our hiring. So that, I believe, has helped us as we are moving through this pandemic. There is no doubt that our budgets will be impacted, particularly with the sales tax and perhaps slightly for property tax. And today is final day for taxes, but we know that there are people that are going to be looking for some type of relief, and we have put as many measures as we can in place. It's too soon for me to give you any figures now because our offices, our CEO are going through those budget scenarios, but I will say that it's a time to tighten our belt, and I think that all of us are going to be required to do much more with less. We've seen this happen, I believe, during the Great Recession, 2008, 2009. I hope that we won't see something as prolonged, but I will tell you that we will all be tightening up our budgets now and being very careful about any unnecessary expenditures. So that's the best I could give you now. Next question, please.
That comes from the line of Josh Haskell. Please state your media outlet.
Yeah, thank you, Josh Haskell with KBC. First question for Dr. Ferrer. The governor's office has been providing us current hospitalization and ICU numbers. I was wondering if you could tell us how many COVID-19 patients are in LA County, specifically in LA County hospitals and in the ICU. And then a question for the sheriff. 200 deputies had to quarantine back in March. Will those deputies be paid for the time that they had to quarantine? Where does that stand?
Okay, well, Dr. Ferrer is getting her numbers. Yes, I can tell you that we are going to retroactively pay those deputies who were quarantined in March. Thank you.
Yeah, I don't have them in my head, but we do have the numbers on current hospitalizations. We do have the numbers of the people currently hospitalized, how many are in the ICU, and we do have the numbers of those that are in the ICU that are intubated. So we can get that to you in the next few minutes. Just contact our communications office and we'll give you that information.
Next question, please.
Comes from the line of Dave Lopez. Please state your media outlet.
Yes, good afternoon, everyone. Doctor, two quick questions, if I may. A number of people are getting the antibody test out of the USC program and your program. Lines are quite long. Do you suggest, would that do any good in your study? Do you suggest people continue to do that? And I know May 15th is now the new date. What would have to happen so that you don't come forward in a couple of weeks and say we are now extending that to June 15th?
Let me start with the first question, which is about the antibody testing. I think there's, there are lots of different labs around, and they may be offering different tests, including serology tests. I know for certain that the study that we're doing, it was, I want to say like by invitation only. I just want to explain the invitation. It's a random sample, so what that does is allow us to get a really good distribution across the county of many different people who then get invited to participate in that. And there are select locations where those people will go today. Those people have all registered. It's not, you can't line up and get this, and the locations are private locations where the testing will happen. But there are other labs that I know are offering serology tests for different reasons. It's not connected to our effort here to do a study that gives us information that we could use. So I don't know the reports of lines, although, as I noted, we are going to be testing between today and tomorrow over 1,000 people in the county. So at these sites, there could be people that are waiting. I do want to thank everyone who did participate in the study with us. It was obviously you had to fill out a lot of paperwork, and then you have to show up at the time you're assigned to show up. But we appreciate, for sure, the public's really embracing of this opportunity to help us really learn more about the infection. In terms about like what happens on May 15th, is that a magic date, and do we go back to normal on May 16th? I've been really honest with everyone, and I'm going to stay honest. I don't know what happens on May 16th. I do not anticipate that we lift all of our restrictions on May 15th. I do know that every day we get closer and closer to a place and a space where we're able to start relaxing some of the restrictions. We feel, based again on the modeling, and I want to thank Dr. Lewis and Dr. Galley for putting together a team to really help us understand what we should be prepared for over the next month. And it clearly shows that we still will see an increase in cases, and we still will see an increase, unfortunately, in the people who die. And until we get to the other side of those numbers, we have to take every precaution imaginable to help us actually chart a course that has us being able to move forward in a responsible way that doesn't create a surge in the number of people that are either becoming infected, infecting others, or unfortunately passing away. Thank you, and we'll take the next question.
That comes from the line of Steve Gregory with KFI News. Please go ahead.
Hi, Barbara. Good afternoon. I wonder if you might be able to, or Dr. Galley can talk about the U.S. naval ship Mercy and how it's going to be helping nursing home residents and sort of how the mission of the Mercy is changing. And also, and I know this is kind of a broad question, but I just felt compelled to ask if, Dr. Ferrer, you have any idea, based on interviews you've had with positive patients, is there a sort of a common theme of how those patients have been contracting the virus in any particular behaviors? I mean, has it all been from breathing it in, touching something? People seem to be a little confused as, exactly the most common form of contracting it, if that's something you can address. Thank you.
Sure, this is Christina Galley. I'll take the first question on the Mercy. First, I just want to extend my continued thanks to the Department of Defense and the federal government for making available the resource of the Mercy ship to Los Angeles County and neighboring counties. It's tremendously needed, and we're very appreciative of that. As I believe the governor announced earlier today, there are plans in the works in terms of developing potential policies and protocols for shifting use of the USS Mercy for use as a skilled nursing facility, or what we call a SNF, a skilled nursing facility site, that individuals in institutional care and skilled nursing facilities could be transferred to. The EMS agency, once a final decision has been made, which is up to the Department of Defense, and once those policies and procedures are complete, then the EMS agency, as part of DHS, will implement the new protocols, including transfer protocols from either skilled nursing facilities or skilled nursing facility level patients in acute care hospitals, and transfer those individuals over to the USS Mercy.
Yeah, thanks for the question on what do we know when we interview people. And as you know, we do try to interview everybody who's positive. We don't get to everybody because sometimes their phones numbers are wrong, and other times they don't actually respond to our calls. But of the people we talk to, the kind of information that we do find out is that many people, the majority of people, have no idea where they were exposed or how they were exposed. And remember, this in part reflects the fact that the incubation period is 14 days. So that's a long time to sort of like look back and see like all of your interactions. It's obviously easiest when you've had an exposure like with a family member or a close friend who already identified you as somebody who had that exposure and you were told to quarantine. And then it's a pretty straight line as to how, in fact, you became infected. So for the people who are quarantined, they're often able to point, to the fact that, yes, I do know the source of exposure. But the vast majority of people actually can't tell us. And this includes healthcare workers. We do a look and do some intensive interviewing of healthcare workers. And again, even with healthcare workers who are in settings where it might be easier for them to say, I had an exposure with a patient, maybe I didn't have my PPE on correctly, or something happened, as the sheriff mentioned, where I wasn't able to use all of my protections. Even in that setting, the vast majority of healthcare workers were not able to identify a for certain source of exposure. So that's the best we can do now, but I think it's a question we'll all be asking. I do want to go back. I do have the hospitalization number, so I just want to give those. Today, the current number of people that are hospitalized is 1,331. These are patients that are confirmed to be COVID positive. Of those patients, 40% of them are in the ICU, and 31% of them are currently ventilated. So high numbers of folks who are seriously ill when they do, in fact, go to the hospital, which is something we've been reporting all along. We have time for one more question.
And that will come from the line of Melanie Mason. Please state your media outlet.
Hi, this is Melanie Mason with the Los Angeles Times. A quick question for Dr. Ferrer. For the additional orders that you mentioned today as part of the extension of the stay-at-home order when it comes to masks, did the suggestion that you made when it came to shoppers and members of the public wearing cloth masks while interacting with essential services workers, is that part of the order or just a suggestion, and is the order pertaining to businesses only? Thank you.
The order pertains just to essential businesses, but it is part of the order that when you are interacting with other people as you're sort of obtaining your essential services, you are required now to, in fact, use a cloth face mask. And again, I want to note there are exceptions there. There are some people who can't wear them, ought not to wear them. They have breathing problems. Certainly, we don't ask you to mask children 2 and under. So, but in general, the order applies to everybody else. So yes. Thank you very much, and we'll now begin our Spanish remarks.
Buenas tardes, soy Hilda Solis, supervisora del Condado de Los Ángeles, representando el Distrito número 1. Hoy el condado tiene una nueva orden oficial de salud para contener el coronavirus. Entendemos que lo que debemos a pedir a los residentes, sabemos que no es fácil. Es muy difícil en este tiempo, pero la nueva orden de salud se basa en un nuevo modelo de datos, en la ciencia y en lo que garantizará nuestra mejor oportunidad de sobrevivir. Sé que muchos quieren celebrar Pascua este domingo, pero les pido que se queden en sus casas y que por favor practican 6 pies de cada persona y que también si salen que se pongan una máscara. Recuérdase por favor que el virus no descansa. Hay muchas formas alternativas para celebrar con nuestra familia y con nuestros amigos. Y pueden usar la tecnología. Sería un buen ejemplo, pues, un vehículo para hacerlo y comunicar con nuestros queridos. También quiero decir que el alguacil está aquí con nosotros para informarles sobre el trabajo para reducir las personas en las cárceles. La salud pública será mejor preservada si reducimos el número de gente en el cárcel, al mismo tiempo manteniendo la seguridad pública en la comunidad. Agradezco que el alguacil haya liberado a personas encarceladas que estaban dentro de 2 meses de su fecha de salida. Espero que también considere liberar a las personas que están de los 4 a 6 meses de sus fechas de salida. También tenemos que encontrar oportunidades para liberar a los jóvenes en los campamentos juveniles que están también en el cárcel. También darles un apoyo, pues que puedan salir más pronto y quedarse en sus casas con sus familias y ponerles, si no, en lugares donde pueden recibir apoyo que necesitan. Este es un problema urgente de salud pública. No podremos esperar hasta que ocurra un brote adentro de estos sitios. También quiero decir que el coronavirus ha afectado nuestras vidas de una manera muy fuerte. Ha sido muy difícil para muchas familias que ahorita están sufriendo. Deberíamos de continuar a practicar la distancia física. La distancia física es importante porque sí nos está ayudando y sí funciona. Muchas gracias a todos y espero que en estos días de Pascual que nos juntamos con nuestras familias, que se quedan en la casa y que ya saben que nosotros estamos aquí en el condado para tratar de dar los mejores ejemplos y también seguridad dentro de esta crisis. Ahora me da gusto a presentarles a la doctora Barbara Ferrer.
Buenas tardes a todos y felices Pascua. Gracias, Supervisora Solis. Estoy muy agradecido por su gran liderazgo y su compasión. Para actualizarlo sobre nuestras estadísticas de hoy, estamos tristes de reportar 18 muertes adicionales hoy. 10 personas tenían más de 65 años, 7 personas tenían entre 41 y 65 años y una persona tenía entre 18 y 40 años. Esto eleva el número total de muertes a 241 en el condado de Los Ángeles y nuestra tasa de mortalidad para COVID-19 es de 2.9%. El parte más difícil de la pandemia de COVID-19 es la pérdida de las personas por el virus. Para todos ustedes que han perdido seres queridos, lo sentimos mucho. Estas son nuestros pensamientos y oraciones todos los días. Hoy también estamos reportando 465 casos nuevos y hay 8.430 casos en total en el condado de Los Ángeles. 2.043 casos han sido en algún momento hospitalizados y el 24% de todos los casos positivos están en un momento hospitalizados. Puedes ver el informe actualizado de los casos del Condado de Los Ángeles en el sitio web del Departamento de Salud en publichealth.lacounty.gov. Actualmente estamos investigando 159 entornos institucionales con al menos un caso confirmado de COVID-19, 4 investigaciones adicionales desde ayer. Estos incluyen hogares de ancianos, instalaciones de vivienda asistida, refugios, centros de tratamiento, viviendas de apoyo e instalaciones correccionales. El total de casos confirmados en entornos institucionales es 1.062 y esto incluye 506 casos confirmados en residentes y 556 en empleados. Nos entristece informar que 67 residentes han muerto a causa de COVID-19 en estos entornos. Esto representa el 28% de todos los muertos. Publicamos la lista de instituciones con casos confirmados en nuestro sitio de web para una vez que han notificado a todos las personales que trabajan, los empleados, los residentes y las familias. Nuestros equipos del Departamento de Salud están trabajando actualmente con todas las instalaciones que tienen un caso positivo. Y la gerencia y el personal están haciendo todo lo posible para proteger la salud de sus residentes. Y muchos residentes en estas instituciones están debajo de la cuarentena si han sido expuestos. A partir de ayer, más de 40.600 personas han sido evaluados y se han reportado resultados en el Condado de Los Ángeles y el 15% fueron positivos. Hoy anunciamos una actualización de la orden del oficial de salud, más seguro en el hogar. Si bien estamos seguros que nuestras medidas de distanciamiento están funcionando, sabemos que ahora no es el momento adecuado para relajar nuestras fuerzas. Debido a que continuamos viendo cómo COVID-19 se extiende por nuestra comunidad, la orden más seguro en el hogar se extenderá hasta el 15 de mayo de 2020. Todas las reuniones y eventos públicos y privados en interiores y exteriores siguen estando prohibidos. Las playas, senderos y parques infantiles permanecerán cerrados y todas las empresas no esenciales continuarán cerradas al público. Hemos incluido nuevas medidas que garantizan que las personas que trabajan en servicios esenciales están más seguros mientras trabajan. La orden ahora requiere que las empresas esenciales proporcionan a todos sus empleados que trabajan cerca de otros empleados y o el público con una cubierta de tela para usar mientras realizan sus tareas. Las empresas esenciales también deberán proporcionar un plan y publicarlo para los empleados y el público sobre cómo implementan los requisitos de distanciamiento físico y limpieza de su lugar de trabajo. Todos podemos participar en actividades en el aire libre como individuos o con miembros de su hogar. Y aún podemos salir de nuestros hogares para acceder a los servicios esenciales, siempre y cuando practicamos distanciamiento físico y usemos una máscara de tela para la cara. Extender más seguro en casa no significa que lo que hemos hecho hasta ahora no haya funcionado. Significa que necesitamos mantener las medidas por más tiempo para que no veamos una mayor aceleración de los casos de COVID-19. Quiero agradecerle a todos que ya siguen estas órdenes. Estas prácticas son las mejores herramientas que tenemos para frenar la propagación de COVID-19 y están haciendo su trabajo. Por favor, quédense en casa, practique el distanciamiento físico y usas una máscara de tela para la cara cuando sales. Vamos todos juntos a superar esto. Y ahora me da un placer traer a la doctora Gutiérrez del Departamento de Servicios Saludables.
Buenos días a todos. Hoy voy a revisar los efectos de las intervenciones de la salud pública a reducir la velocidad de transmisión del coronavirus. Y también voy a revisar el modelo estadístico que nos ayuda con las proyecciones de dónde estamos actualmente y dónde vamos en el futuro. Hoy, como has oído ya, podemos decir que el distanciamiento físico está funcionando en el condado de Los Ángeles. Sabemos que las directivas de salud pública han sido difíciles para cada persona en Los Ángeles. Estamos luchando, estamos batallando, los angelinos estamos sufriendo. Y en unos casos hemos perdido un ser querido y casi todos hemos sentido los efectos de los directivos en nuestros negocios, trabajos y mucho más. Las acciones que estamos pidiendo de todos son sumamente difíciles y por esas razones es la responsabilidad del sistema público en nuestro condado hacer todo lo posible para asegurar que las recomendaciones y los directivos están basados en datos y ciencia. Es cierto que cada día aprendemos más. Hoy sabemos más que ayer y mañana sabremos más que hoy. Los que tienen el slide en el website del condado pueden seguir los slides conmigo. Una de las cosas que hemos aprendido es que el tiempo desde cuando una persona está susceptible, y todos estamos susceptibles, esa persona se expuesta al virus, se infecta con el virus, enseña síntomas del virus, no tiene síntomas del virus y se recupera del virus, es un tiempo largo. Y sobre todo al principio, cuando quizás la persona no sabe que tiene el coronavirus, es un tiempo cuando es fácil pasarlo a otra persona. Y es la razón por cual la recomendación de mantener la distancia física es tan importante. Se oye la frase flatten the curve o aplanar o aplastar la curva. Esto no significa que hemos eliminado el virus. Esto significa que hemos puesto un freno en la velocidad de transmisión. Y con el tiempo, las intervenciones públicas bajan la población que está infectada. Y sumamente importante, no sobrepasamos la capacidad de los hospitales a cuidar los enfermos. Y si usted tiene un ser querido ingresado, quieres tener confianza que el hospital tiene el espacio, el equipo, el personal que necesitan para cuidar al paciente. Mantener la distancia física está trabajando y es la arma más grande que tenemos en combatir este virus. Otras directivas de salud pública como la máscara y lavarse las manos también están ayudando. En los días, semanas, meses para avanzar en esta lucha, necesitamos frenar la aceleración del virus. Y la distancia física está haciendo precisamente eso. Ahora vamos a hablar sobre unos escenarios y los proyectos dependiendo si seguimos con la distancia física. Si no habíamos hecho ninguna distancia física, se pueden imaginar que los casos siguen subiendo todos los días, en una manera que tenemos demasiados casos y al fin del mes tenemos miles y miles de casos. Ahora, si levantamos la directiva de mantener la distancia física hoy, lo que vemos es que si como no hubiéramos hecho nada y los éxitos que hemos logrado por cumplir con las directivas de mantener en casa, pues son en vano, porque aceleramos otra vez el número de personas que necesitan estar en el hospital. Ahora, si vemos la línea que tenemos hoy estamos en un lugar porque hemos cumplido con la directiva de mantener la distancia física y esta línea muestra que pusimos un freno en la velocidad de casos. Sí tenemos casos, pero no de una manera que sobrepasa la capacidad de los hospitales. Si no mantenemos la distancia física, casi todos los residentes del condado de Los Ángeles habrán sido infectados cuando llegamos al verano. Lo voy a decir una vez más. Si no mantenemos la separación física, casi todos los residentes en nuestra ciudad y condado estamos infectados. Eso incluye los infectados actualmente, los infectados previamente, esos que se recuperaron y esos que fallecieron. En este momento, todos somos la primera línea. Sus acciones, su comportamiento hasta ahora ha salvado vidas. Y si seguimos manteniendo la distancia física, podemos seguir salvando vidas. Ahora, las predicciones de demanda en el condado de Los Ángeles. Sé que hay muchas preguntas sobre si tenemos suficientes camas, si tenemos suficientes camas de cuidado intensivo, si tenemos suficientes ventiladores. Y cuando usamos el modelo, pensamos que sí tenemos suficientes camas, sí seguimos con el sistema de mantener las intervenciones, de mantener la distancia física. Pensamos que tenemos suficientes camas, pensamos que tenemos suficientes ventiladores. Con las mismas oposiciones, no tenemos suficientes camas de cuidado intensivo. Pero, debido a esto, hemos hecho muchos esfuerzos en curso para aumentar la capacidad de cama de cuidado intensivo. Estamos convirtiendo las camas existentes para hacer más camas de cuidado intensivo. Han oído a través del barco, estamos pasando los pacientes al barco del Mercy, estamos utilizando el Hospital de San Vicente. Y con esto, si mantenemos la recomendación de seguir con la distancia física, pensamos que sí vamos a poder tener suficientes camas de cuidado intensivo. Con eso, lo que vemos es que si aplastamos la curva, le dejamos que los hospitales tengan suficiente tiempo para preparar todo lo que necesitan para cuidar a las personas que necesitan. Y la manera de que vamos a seguir eso es siguiendo las recomendaciones y las directivas del Departamento de Salud Pública para mantener la distancia física. Y con eso le voy a pasar el micrófono al sheriff Alex Villanueva.
Buenas tardes a todos. Y en este Viernes Santo quiero a este momento expresar las condolencias, el pésame a todas las familias en este condado y alrededor del mundo que tuvieron familiares que murieron por el COVID-19. Esta pandemia es un oponente muy fuerte, pero estamos cometidos todos los departamentos del condado, todos del gobierno, buscando manera de trabajar juntos, de crear esa distancia social para poner la curva, como dicen, disminuir la curva y la transmisión del virus. Y quiero darle un saludo y una gracias a todos los que están trabajando en la seguridad pública, los que están trabajando en la línea, en la frontera, los que están trabajando dentro de todas las funciones esenciales del gobierno y de la salud pública, todo lo que están haciendo, trabajando juntos. Estoy muy orgulloso de ellos y estoy muy agradecido por todos los esfuerzos que están haciendo. Y ese mismo nivel de agradecimiento lo tengo que extender al público, porque están practicando todos la distancia social. La nueva orden de la salud pública quiere decir que todos tienen que tener una máscara en la cara cuando salen de la casa, van a compras al mercado, van a estar cerca de otras personas a esa distancia mínima de 6 pies. Tienen que estar usando esto cuando están fuera de la casa. Cuando están dentro de la casa o están dentro de su automóvil no es necesario, pero obviamente cuando están haciendo algo esencial y están en contacto con otras personas, tienen que tener esto puesto. Es muy importante para su salud, su bienestar. Y hemos hecho muchas cosas en cuanto a patrullaje. Tenemos muchos más alguaciles trabajando en las calles. Los sacamos de todas las posiciones administrativas del departamento y ahora hay mucha más gente, alguaciles, trabajando en las calles que antes de la pandemia. Y en este momento quiero darle las gracias a una joven alguacil que se graduó de la academia hace dos semanas. Se llama Wendy Fuentes y ella ayer por la noche, a las 8 de la noche, estaba pasando encima por la calle Clara en la ciudad de Cudahy. Es una puente que cruza el río Los Ángeles. En la lluvia, en la oscuridad y el río a cauce completo, ella vio una mujer al lado del río como si fuera a brincar y cometer suicidio. Ella llamó a la 911, salió en la lluvia, empezó a hablar con ella mientras esperaba a los que respondían de la estación del este de Los Ángeles, y ella pudo convencerla que no se lanzara al agua. Y cuando llegaron los otros alguaciles de la estación, pudieron esforzarla que al otro lado del pavimento, a la seguridad. Entonces le sometieron a una custodia de 72 horas para observar su estado psiquiátrico. Y eso es un ejemplo de lo que estamos haciendo. En las cárceles reducimos la población por más de 20% para poder hacer cuarentenas, aislar los que están exhibiendo síntomas del virus y poder darle todo el tratamiento médico que necesitan. Y eso ha sido 6 casos ahora que tenemos dentro de las cárceles, pero en comparación, por ejemplo, con el condado de Cook en el estado de Illinois, ellos tienen más de 400 casos positivos. Estamos haciendo algo bueno en las cárceles y seguimos trabajando con los oficiales de medicina y todo el sistema de justicia criminal. Y ahora, lo más importante, como la gente no está en las escuelas, no estamos visitando a los de la tercera edad en los hogares de convalescentes, tenemos que estar siempre observando si alguien que está perjudicado, ya sea de tercera edad, por violencia doméstica o por abuso de niños, que hay que reportar. Si tenemos algo, una preocupación, por favor, no mantenga esa preocupación por dentro, sino llame a los oficiales, ya sea el departamento de policía, departamento de alguacil, y nosotros vamos a cerciorar que esa persona está bien. Eso es algo muy importante. Y en este momento, Ryan, if there's any questions in Spanish.
We do have one question. It comes from the line of Eric Mendoza. Please state your media outlet.
Hola, muy buenas tardes. Eric Mendoza de Telemundo Canal 52. Buenas tardes a todos. Nuestra pregunta es para la doctora Ferrer. ¿Nos puede explicar cómo funcionan los exámenes anticuerpos que iniciaron hoy por parte del Condado de Los Ángeles y la Universidad del Sur de California? ¿Y cuál es el objetivo de esta prueba?
Mira, les quiero informar que tenía otra cita la doctora Ferrer, entonces si necesita más información puede contactarse con nosotros y les vamos a mandar ese informe. Pero con esto pues ya quiero decir que tenemos que ya cerrar la conferencia, pero queremos dar los datos donde pueden seguir con sus preguntas.
Eric, buenas tardes. El correo electrónico para tu pregunta sería, por favor, dirigido a pio@ceoem.lacounty.gov. Te repito, es pio@ceoem.lacounty.gov. Gracias.
Antes que terminamos, quiero decir también que ya hace como 2 días que abrimos un centro de pruebas en el Colegio Comunitario del Este de Los Ángeles. Si quieren información en cómo registrarse, va en el número 211 para ponerse su aplicación y a ver si les pueden hacer la prueba. También tenemos otro centro en Pomona, en el Fairplex, donde también pueden seguir información, hacer la prueba. Llame a 211. Y por favor, no niegan, póngase la máscara. Tengo uno aquí que me lo hizo una mujer de mayor edad. Se puede ser bien fácil, lo puede usar así en la casa. Se puede ponerlo y estar ahí con su familia o cuando sale a las tiendas o lo que sea, ahí están. Muchas gracias a todos. Ya terminamos con el español. Now I'd like to transition to our Armenian language presentation, and I'd like to ask Garen Ohanesian, our Public Health Nursing Supervisor representing Public Health, to please join us. Thank you.
Բարի օր բոլորիդ։ Շնորհակալ գուզեմ հայտնել այդ բոլոր Los Angeles County Department-ին, ղեկավարներուն իրենց զորությամբ եւ հասկացողությամբ։ Գուզեմ հիմա ներկայացնել մեր ներկայի կարգավիճակը։ Այսօր ցավոք սրտով կհայտնենք, թե 18 նոր մահացուներ ունենք եւ ուրեմն 10-ը 65 տարեկանին ավելի են, 7-ն 40-ն մինչև 41-ը մինչև 65 տարեկան են, 1 հատը 18-ն մինչև 40 տարեկան է։ Ուրեմն մինչև այսօր 241 մահ կա Los Angeles շրջանի մեջ եւ մահացուներեն ուրեմն դոգոսը 2.9%-ի բարձրացած է։ Ամեն օր երբ կհայտարարեմ այս վիճակը, շատ տխրությամբ կսենք, որովհետև կմտածենք եւ գաղութենք այդ բոլոր անձերուն, որ իրենց սիրելիները գործունեացած են, եթե անդանական կամ իրենց սիրելիներն էին, բարեկամները։ So խորին ցավակցությունները գուզեմ հայտնել բոլորիդ։ Այսօր գուզենք դեղակացնել, թե 475 նոր հիվանդներ ունենք։ Այս վերջի 48 ժամով 900 ավելի հիվանդներ ունենք եւ իսկ բոլոր Լոս Անջելես սրճանի մեջ հիմա թիվը բարձրացած է 8430 անձերու։ Long Beach Department-ով 287 եւ Pasadena'i Department-ն 94։ Հիվանդները ուրեմն adonk որ դուն չունին homeless-ները ուրեմն 18 անցեն 3 հատը զադ թրած ենք որ quarantine-ին մեջ են եւ հիվանդանոցներուն մեջ ուրեմն այսօր թիվը 24 դոգոսն է թեր եւ բոլոր վիճակը 2043 հոգի ունենք որ ադեմը հիվանդանոց էին Եթե վերջին դեղեցությունները գուզեք իմանալ հաջիկ մեր վեբսայթին կացեք at publichealth.lacounty.gov-ին Եվ գուզեմ հայտարարել թե Sheriff Department-ը եւ Fire Department-ը ուրեմն իրենք ալ քեյսեր կունենան ուրեմն ոստիկանական կամ Sheriff Department-ն 29 ներողություն positive case-եր եղած են եւ 223 անձեր յետ կորձի եղած են եւ 376 անձիկ թեր դանն են quarantine եղած են եւ հրսեջի department-ը որ fire department-ն է ուրեմն total նորեն նույնի 14 case-եր ունին 21 հատը իրենց դան մեջ են եւ 2 հատը դժբախտաբար հիվանդ են եւ 12 անձիկ յետ կորձի եկած են Ներկայիս ուրեմն հիմա 159 Զանազան հաստատություններ ունենք, այսօր 4 հատ ավելի սկսած է, որոնք ունեցած են նվազագույն կոնե մեկ հատ անցմը, որ կորոնավիրուս 19 հիվանդացած է։ Այս տեղերն են ձերանոցներ, դուներ եւ ձերերու դեղեր, որ կոգնեն ձերերու, աբաստարաններ, shelters, բուժման տեղանոցներ եւ փանդեր։ Այս հատածություններուն հիվանդներուն թիվն բարձրացած է 1062-ի, որոնց մեջ աշխատավորներ եւ ապրողներ կան։ Բոլոր թիվերը այս ապրողներուն համար 343 բարձրացած է եւ 373 բարձրացած է աշխատավորներուն։ Նորեն սրդի ցավով բացատրենք թե 51 հիմա նոր 50 ներողություն 67 անձեր գմահանան ատտեղերեն որ ձերանոցներեն են ուրեմն հիմա բարձրացած է 28%-ի Մենք ուզենք դեղեկացնենք նորեն ատտեղերը որ փանդերու մեջ են Ուրեմն 47 հատ ունենք, 6 փանդարգյալներ են եւ 41 հատը աշխատավորներ։ Եվ state prisons, որ California-ի փանդերն են, ուրեմն 23 հատ հիվանդներ ունենք եւ 12 հատը փանդարգյալներ են եւ մնացածը աշխատավորներ։ Եվ փանդերգան, որ միան փոքրերու համար է juvenile facilities գոչվի, անոնց մեջ 2 հատ ուրեմն կան, որ աշխատավորներ են։ Եվ այս բոլոր դեղեցությունները գնաք ավելի գտնել Department of Public Health-ին publichealth.org-ին դակ։ Ուրեմն եթե երթակ ադեղեցությունները գտնենք, այդ բոլոր as դեղերը որ կան, բայց առաջ notification գուտանք ադանցերուն որ գփնագին, կամ գաշխադին, կամ իրենց ընտանիքներուն։ Գուզեն գուզեմ ասել թե ուրեմն թեր թիվերը կբարձրանան գոր այս դեղերուն եւ մենք աջակցությամբ գոքնենք այդ անձերուն մեր Department of Public Health-ի բոլոր փուշքույրերը եւ մեր բժիշկները ուրեմն իրենց հետ կխոսենք եւ գսենք թե ինչ պետք է անեն մեր ղեկավարությամբ եւ ադոնք որ պետք է զատ լան կամ quarantine-ի մեջ լան մենք կբացատրենք եւ գսենք ուրեմն մինչև ապրիլ 9 այսօր ուրեմն 40,600 անց կորոնավիրուսի քննություններ եղած են եւ 15%-ը positive թրական պատասխան ունեցած են նորեն ավելի լավ գնենք որ testing-ով որ կամ քննություններով բայց թեր թշպախտապար թեր գամած է բոլոր թեստերը լալու եւ պատասխանները sometimes ավելի ուշ կան գոր ամենակարևոր նյութը այսօրվա այդ է որ այսօր կհայտարարենք at safer at home որ գա որ ավելի ապահով է եթե դու մնաք ուրեմն այդ առողջապահության հրամանակիրը որ կա ուրեմն պիտի ավելիա մինչև մայիս 15 2020 մինչև մայիս 15 նորեն ուրեմն ասիգա գնենք որովհետև այս թիվերը շատ բարձրացած չեն բայց թեր թիվերը կան Ադոր համար պետք է միասին օգնենք եւ միասին պետք է աշխատենք որբեսի ավելի կամացնել աս հիվանդությունը մեկ անցի մույս անցի Թեր գրնանք ուրեմն միասին մեր ընտանիքներուն հետ քալել անձերը որ ծեր դանը գմնան բայց նորեն պիտի փակվին բոլոր public եւ private դեղերը ուրեմն չեք կրնար ծեր դանը մեջ կամ թուրսերը չեք կրնար լալ ուրիշներու հետ եւ բոլոր բիչերը կամ լողափները trails ամեն դեղ որ ավելի բարձ open է պիտի կոծվի մինչև playground-ները որ երեխաները կխաղան միայն եւ ուրիշ բամանավոր ավելցած է աս օրենքին մեջը ուրեմն essential measures որ գսենք essential workers ադոնք որ բարդաթիրման պետք է աշխատին ինչպես մեր մարքեթները որ քնումներ գնենք կամ gas station-ները կամ բանկաները բոլորը պետք է ուրեմն այս անձերը որ պետք է թեր աշխատին նոր օրենքը այդ է որ իրենց որտեղ որ աշխատին պետք է թմակներ դան իրենց աշխատավորներուն եւ պետք է բացատրեն թե 6 ոտ հերու ինչպես պիտի լա կնան թեյփեր կամ եւ մապը պետք է շինեն եւ post-nen եւ տնեն եւ բացատրեն որ իրենց կորզավորներուն ուր պիտի եւ ինչպես պիտի լա երկրորդ ուրեմն cloth face կսեն որ ուրեմն թմակը որ գդորե շինված է եւ ասիգա բարդաթիրը բոլոր այդ բիզնեսները որ ունին եւ environmental health department-ը պիտի կա իրենց ամեն եթե հարցում ունենան պիտի ասեն եւ բացատրեն թե ինչպես կրնան օգտակար դառնալ որբեսի աս օրենքները հետևին շիտակցեվով ուրեմն ադիգասինք երկրորդ շատ կարևոր է որ եւ շնորհակալություն նորեն գուզենք հայտնել թե այդ անձերը որ օրենքներուն կհետևին եւ շատ կարևոր է որ թեր հետևիկ ասիկա շատ կարևոր է որբեսի ավելի թիվերը շատ արագ չի բարձրանան եւ նորեն շնորհակալություն գուզեմ հայտնել բոլորիդ եթե ուրիշները տեսնեք որ չեն էներգոր հաջիկ մույսերունա հիշեցուցեք Եվ ինչպես որ գա ամեն մարդ պետք է թմակ հակվի այսօր երեկվնեն սկսյալ եթե դուրս պիտի ելեք եթե դան մեջ պետք չունիք տնելու կամ ասենք թե երբ որ օտոգը քշեք պետք չունիք տնելու եթե զադեք բայց եթե դուրս պիտի ելեք բարդաթիր է ամեն մարդ թմակը տնելու հիմա կտեսնեք որ ես թմակ չունիմ բայց թմակը բայսագիս մեջն է հոստեղ ամեն մարդ եթե գտեսնեք, որ միշտ կմաքրեն մայքը եւ ամեն ինչը։ Շատ կարեւոր է որ եւ ադոր համար երբ որ մեկը որ կխոսի, որովհետեւ հանգիստ լսեք, որ ինչ կխոսենք որ։ Բայց բոլորս թմագներ ունենք եւ երբ որ դուրս ելենք թմագը գտրենք եւ որովհետեւ մենք ուրիշներուն չի վարագենք եւ ուրիշները մեզի չի վարագե։ Գուզեմ քանի մվարյան բացատրել ասթմակներուն մասին։ Ուրեմն կարևոր է որ թմագը շինեն գդոր է եւ կոթոն է, ադիգա ամենելավն է, որբեսի գրնակ շնչել։ Եթե պլաստիկով լան է, շունչեք գրնար ունենալ։ Սո ադիգա շատ կարևոր է։ Եվ երբ որ թմագը պիտի տնեք ծեր երեսին, կարևոր է որ ծերքերը լվալ, թմագը տնել են առաջ, եւ երբ որ թմագը դուրս կտնեք նորեն ծերքերին մաքուր պետք է լա, եւ երբ որ թմագը ետ կհանեք, հաճ դոբրագի մեջ տրեք։ Եթե դոբրագի մեջ չի տնեք, մաքուր դոբրագի մեջ տնեք եւ արարգամի վրա գրնակ տնել, գրնա ադիգա աղդոդը լալ եւ ադիգա լավ չի լինի, որովհետեւ գրնա վարագել ցես։ Ամեն անգամ կարևոր է երբ թմագը տնել եւ թմագը վար տնելեն յետքը նորեն ծերքերը հաջիկ լվացեք։ Ամենալավ բանը, եթե կարելի է ամեն օր այդ թմագները լվալրեք եւ պետք է ուրեմն մեկտեղ լա աս աղդոդ թմագները եւ եթե քիչ եթե աղդոդ է կամ եթե բادرված է հաջիկ հանեցեք ադիգա եթե ադանցեր որ եթե չի գնար սունչ առնել լավ, բեք չէ թմակ թրվի, եթե 2 տարեկանեն բագասե բզիկներուն մի տնեք, 3-ն 8 տարեկաններուն պետք է տնեք, բայց ուշադիր պետք է լակ իրենց մինակն մի ցկեք, որ սղափամը չլա, եւ գուզեմ բացատրել, որ surveillance project մգնեն գոր հիմա, եւ այդ project-ը այդ է, որ գփորձեն գոր հիմա քնություններն էլ որ իմունային սրդեղություն մնե։ Այսինքն չի ցցներ եթե ադիգա միան պիտի ցցնե եթե հիմա եթե ունին կամ առաջվնե եթե ունեին as coronavirus-ը։ Երկրորդ scientific panel advisory panel գորձա պիտի լա, ուրեմն քիտական խորհրդավարության հանձնաժողով մը պիտի լա եւ ադոր համար պիտի գիտնանք ինչ որ ատստադիները որ լան ցեզի պիտի բացատրենք այսինքն շատ կարևոր բան է որովհետեւ մենք գիտնանք եւ ցեզի հետ կփաժնենք so այժմ կավարտենք մեր այսօրվա համաժողովը շնորհակալություն and this concludes our press conference today thank you